Why are specific assessment tools crucial for PTSD criteria? Imagine trying to solve a puzzle without all the pieces. That's what diagnosing post-traumatic stress disorder can feel like without the right assessment tools. PTSD is a complex mental health condition triggered by experiencing or witnessing traumatic events like serious injury, sexual violence, or threats to life. The diagnosis relies on specific symptoms categorized into clusters: intrusive memories, avoidance behaviors, negative mood and thoughts, and heightened arousal. These symptoms must last more than a month and cause significant problems in daily life. The challenge is that many of these symptoms overlap with other mental health issues, such as anxiety or depression. Without precise tools, clinicians might overlook important signs or mistake PTSD for something else. This is where standardized assessment tools become essential. They provide a structured way to evaluate each criterion carefully and systematically. For example, the clinician-administered PTSD scale for DSM-5, or CAPS-5, is considered the gold standard. It involves a detailed interview that covers symptom presence, severity, how long they've lasted, and how they affect daily functioning. This thorough approach helps ensure the diagnosis is accurate and complete, which is vital for planning effective treatment. Another useful tool is the PTSD checklist for DSM-5, or PCL-5. It's a self-report questionnaire that individuals can fill out to screen for PTSD symptoms. While it doesn't replace a full clinical interview, it's helpful for initial screening, tracking symptoms over time, and making provisional diagnoses, especially in settings where a clinician isn't immediately available. Both tools are designed to match closely with the DSM-5 criteria, which helps reduce errors and inconsistencies across different clinicians and settings. Using these assessment tools offers many benefits. They guide clinicians through all the necessary questions, making sure no important symptom is missed. They also allow for measuring how severe symptoms are, which helps track progress during treatment. Additionally, they support research efforts by providing consistent ways to measure symptoms across studies. For someone living with PTSD, getting an accurate diagnosis is the first step toward receiving the right care. Misdiagnosis can lead to ineffective treatments, longer suffering, and unnecessary stigma. These tools help ensure that the diagnosis truly reflects the person's experiences and needs, opening the door to evidence-based therapies like trauma-focused psychotherapy and appropriate medication when needed. In essence, specific assessment tools are crucial for PTSD because they help make diagnoses precise, consistent, and thorough. They ensure clinicians identify the full range of symptoms, evaluate how severe they are, and monitor changes over time. This level of accuracy is key to providing effective treatment and improving outcomes. Remember, a formal diagnosis should always be made by a qualified healthcare professional. If you or someone you know is concerned about PTSD, seeking professional evaluation and support is the best step forward.